You know, when you brought in all this research on dry mouth, I have to admit, I thought, really? Dry mouth? But then I started looking through these excerpts, and wow, this is one of those things we just don't think about until it becomes a problem. And by then, it might be a sign of something bigger going on.
It's true. Dry mouth or xerostomia can be surprisingly sneaky. It can be a symptom of a whole range of issues,
Mm.
from medications to underlying health conditions.
And to think most of us just kind of brush it off as a minor annoyance, but you're saying it could be a bit of a warning sign.
Exactly. Think of it this way. Your body is always talking to you, sending signals. And sometimes those signals are subtle, like a persistent dry mouth.
That makes sense. But before we dive into all the what ifs, let's start with the basics. I mean, what exactly is happening when we experience dry mouth? Is it as simple as not drinking enough water?
Well, staying hydrated is definitely important, but it's more complex than that. See, saliva isn't just water. It's actually this dynamic fluid with a specific balance of enzymes, electrolytes, and minerals that all play crucial roles in our oral health.
Wow, I never really thought about saliva being so complex.
Right. And when the composition or the flow of saliva is disrupted, that's when we start to experience the symptoms of dry mouth.
Okay, so it's about the saliva itself, not just the feeling of dryness. So
Mhm.
what are we talking about when we say symptoms? How do you know if it's just a passing thing or something more?
Well, the obvious one is that parched, sticky feeling in your mouth. You might also notice your throat feels dry or your tongue feels rough or even a bit swollen.
That makes sense. But the excerpts you provided also mentioned some less obvious symptoms, like a scratchy throat or even changes in your voice.
Absolutely. See, when your mouth is dry, it can affect your vocal cords too. They need moisture to vibrate properly. That's why teachers, singers, anyone who uses their voice a lot are more prone to experiencing these symptoms.
I can see how that would be a real problem. And I imagine it can impact your quality of life in a lot of ways, not just your ability to sing karaoke.
You're right. Imagine trying to enjoy a delicious meal when your mouth feels like sandpaper. Or think about how difficult it would be to swallow certain foods without enough saliva. It's not just uncomfortable, it can make everyday activities a real struggle.
It's amazing how something we take for granted, like saliva, can have such a big impact on our lives when it's not working properly.
And that's just the tip of the iceberg. Because here's the thing, dry mouth is rarely a standalone issue. It's often a symptom of something else going on in the body.
Like what? Give me the deep dive. What are some of the things that can cause dry mouth?
Well, the research you shared breaks it down into 6 main culprits.
Oh.
Some are pretty common, like medication side effects. Both prescription and over-the-counter medications can interfere with saliva production.
That's something I definitely wouldn't have thought about.
Right. We often pop a pill without thinking twice about the potential side effects. And it's not just medication. Things like tobacco and alcohol can dehydrate your mouth, leading to that dry, sticky feeling. Even excessive caffeine can be a culprit.
Wow. So even our daily habits can contribute to this. What about other medical conditions?
Yes, certain diseases can also cause dry mouth. Diabetes, for example, is a common one. When your blood sugar's high, your body tries to flush it out through urine, which can lead to dehydration, and you guessed it, dry mouth.
It's like a chain reaction throughout the body.
Exactly. And then there are autoimmune diseases like Sjogren's syndrome. Have you heard of that one?
It rings a bell, but I'll be honest, I'm not sure I know exactly what it is.
Basically, with Sjogren's syndrome, your immune system mistakenly attacks the glands that produce moisture in your body, including the salivary glands. This leads to a decrease in saliva production, causing, you guessed it, dry mouth.
So in this case, dry mouth is a result of the immune system misfiring, not just a side effect of something else.
Precisely. And this is why it's so important to look at dry mouth as a potential clue, not just a nuisance.
That's fascinating, and it makes me think about all the other potential causes. What else is on the list?
Well, cancer therapy is a big one. Radiation and chemotherapy can both damage the salivary glands, leading to dry mouth as a side effect.
That's heavy stuff. I can't imagine going through cancer treatment and having to deal with chronic dry mouth on top of everything else.
It's definitely a challenge, and it highlights the importance of supportive care for people undergoing these treatments.
Absolutely.
Are there any other surprising culprits we should know about?
Believe it or not, even nerve damage can disrupt saliva production.
Nerve damage, how does that work?
Well, think of your nervous system as a complex communication network. If there's damage to the nerves that send signals to your salivary glands, those signals can get disrupted, leading to decreased saliva flow.
Wow, so even seemingly unrelated injuries could have this long-term effect on our mouths. This is blowing my mind, and it sounds like getting a proper diagnosis would be crucial in figuring out how to address it. You're absolutely right. Figuring out the root cause of dry mouth is key to finding the right treatment. It's not a one-size-fits-all solution.
So where do you even begin? Is it as simple as telling your doctor, hey, my mouth feels like a desert lately?
Well, it's a good starting point, but there are more precise ways to diagnose it. Your dentist is actually equipped to diagnose dry mouth, not just a medical doctor.
That makes sense. They are the mouth experts after all. What would that look like?
One method they might use involves actually measuring the flow rate of your saliva. They'd essentially collect your saliva after stimulating your glands, maybe with a little citric acid.
So like a science experiment for your spit.
Exactly. And they have a fancy name for it too, thiometry.
Sialometry. I'll admit that sounds a lot more impressive than spit test. But okay, let's say you figure out the cause of the dry mouth. What comes next? What can you actually do about it?
Well, the good news is there are a lot of options, and they can range from simple lifestyle changes to medications.
Okay, so walk me through it. What are some of the first lines of defense?
Hydration is key. It sounds obvious, but sipping water throughout the day makes a bigger difference than you might think. And remember those culprits we talked about earlier. Cutting back on things like caffeine, alcohol, even mouthwashes with alcohol can help minimize dryness.
That makes sense. So it's not just about adding hydration, but also reducing things that might be counteracting those efforts.
Exactly. And even something as simple as breathing through your nose instead of your mouth can help prevent that drying effect.
It's amazing how these small tweaks can make a difference. But what about situations where you can't just avoid the cause? Like if it's medication related, are you just stuck with dry mouth then?
Not necessarily. There are both over-the-counter and prescription options that can help stimulate saliva production or provide relief from the dryness.
Like what? Give me the rundown.
Well, there are sugar-free gums and lozenges specifically designed to stimulate saliva flow. Some people find relief with artificial saliva products, which can mimic the natural moisture in your mouth.
So it's like giving your mouth a little hydration boost throughout the day.
Exactly. And for more severe cases, your doctor might prescribe medications that can actually increase saliva production.
That's good to know. But I have to admit, I'm intrigued by this MI paste that was mentioned in the research. It sounds like more than just a temporary fix.
It is. What's fascinating about MI paste is it contains a mineral called bioavailable calcium phosphate.
Okay, and that's important because
Remember how we talked about saliva being more than just water? It also contains these minerals that are essential for healthy teeth. And where their key roles is remineralization. Essentially, they help repair those microscopic weaknesses that can develop in our tooth enamel over time.
so it's like giving your teeth their own little repair crew.
Exactly. And what MI paste does is it delivers those same minerals directly to the teeth, essentially mimicking the natural remineralizing power of saliva.
That's amazing. It's like giving your mouth a spa treatment to restore its natural balance.
Exactly. And it highlights this crucial point. Saliva isn't just about comfort. It's essential for protecting our teeth and gums.
Which brings us to the not so fun part of this conversation. What happens when you ignore chronic dry mouth?
Right. We've talked about the annoying symptoms, but the consequences can go far beyond just discomfort.
So let's talk about those consequences. What are we risking if we just decide to live with dry mouth?
Well, one of the biggest risks is cavities. Saliva actually plays a key role in neutralizing acids in our mouths, which is something we're constantly exposing ourselves to through food and drinks. Without that buffering effect, your teeth become more vulnerable to decay.
That makes sense. It's like saliva is constantly working to protect our teeth even when we're not thinking about it.
Exactly. And it's not just about neutralizing acids. Remember that remineralization process we talked about? Well, without enough saliva, your teeth are missing out on those essential minerals, making them weaker and more prone to erosion over time.
So not only are you more susceptible to cavities, but they also have a better chance of really doing some damage.
Unfortunately, yes. And it's not just your teeth that suffer. Dry mouth can also wreak havoc on your gums.
Oh, right. Because saliva helps keep our whole mouth healthy, not just our teeth.
Exactly. When your mouth is chronically dry, it creates a breeding ground for bacteria. This can lead to gum inflammation, also known as gingivitis, which can progress to more serious gum disease if left untreated.
Wow, so it really is a domino effect. Dry mouth creates this cascade of problems that can ultimately impact the health of your entire mouth.
And it goes beyond just your oral health. Think about it. If you're constantly dealing with a dry, sticky mouth, it could affect your sense of taste, making food less enjoyable. It can make it difficult to swallow, which can impact your diet and nutrition. Some people even experience difficulty speaking clearly when their mouths are dry.
It's amazing how something that seems like such a minor inconvenience can have such a far-reaching impact on our lives.
It really is. And that's why it's so important to pay attention to your body's signals and advocate for yourself if something feels off.
You're right. We often dismiss these seemingly minor symptoms, but they could be pointing to something more significant.
Exactly. And in the case of dry mouth, addressing it early on can make a world of difference in preventing those more serious consequences down the road.
So the takeaway here is clear. Don't ignore a persistently dry mouth.
Hmm.
Talk to your doctor or your dentist. Explore those treatment options. And remember, a little saliva goes a long way in keeping your mouth healthy and happy.